Oh, I have to press continue here. Sorry.
Oh, does it say something?
Yeah,
Oh, like
that's interesting. That's a new one.
what does it say?
I have to. It says, "Do you consent to being recorded?"
Oh, because I clicked
That's
record. Okay.
yeah.
Okay, so I'm gonna put in some info here before we start, and then I'll introduce the session in a minute. All right. Hi, everyone. Happy Wellness Wednesday. My name is Claudia Wong. I'm a nurse practitioner and co-founder of Mindful Nurses. Thank you for joining us again for another wonderful session. Each week we have sessions about self-care promotion for nurses in particular. I mean, a lot of these tips can help a lot of people, but our main focus is to promote self-care and wellness for nurses. And for today's session, I'm really excited to introduce Mary Ann. She's going to be talking about fitness nursing, and bridging medicine and fitness together. Fitness and exercise is so important, as we know, for physical, cardio, mental health. She'll also talk about habit structure, developing good habits, and her journey into fitness nursing and her past experience with case management. So without further ado, I'd like to introduce Mary Ann. She's zooming in from Canada, and thank you so much for being here.
Thanks for having me, Claudia. I'm excited to be here.
So why don't you tell us a little bit more about yourself and what you'll discuss in the session.
Okay, so my name is Ann Masesar, and I'm a fitness nurse located in Manitoba, so it's just above North Dakota, if anybody has any idea of where that is. My background and training has been mainly in community health nursing, gerontology, research, education, and community health, and nursing informatics. So that's kind of the field that I was really enjoying when I was in my nursing practice. So I came out of nursing, working out of the community. I ended up doing case management, care coordination for about 15 years. And so there's a number of things that I ended up finding out during that period of time that just kind of opened my eyes towards taking a look at where else can I offer support and assistance and guidance towards helping people get healthier. So, and a big thing in case management, as you know, we're seeing individuals when they're already, deep into their chronic disease, they're physically disabled, and oftentimes as a case manager, we're just trying to really help them navigate their healthcare, access the healthcare system, utilize other healthcare disciplines, but they're already at the point where they're needing quite a bit of support. And so I found that, what about the people who don't want to be in this position? A lot of the times when I would meet these clients, they would say, had I taken better care of myself when I was younger, I wouldn't be in this position now requiring so much help. And I said, there isn't anything really. A lot of it is really up to us or how we figure things out. So I wanted to kind of look into that a little bit deeper and find out like what is, where can we help people in the generation that are still kind of, at risk, but still healthy, working. How do I help support that group? Because, these were the caregivers of the people that I was working with. And I was finding that there was no supports for them, and their health was deteriorating pretty much at the same rate as their parents were. So that was kind of where I found, okay, let's kind of take a look into this a little bit deeper.
Yeah, right. Yeah, in nursing, the medical field, you do see patients sometimes at end stage of conditions and difficulty, navigating care.
Yeah, preparing them for placement, getting, especially in home care, like depending on the supports that they have at home, they can be, really in their Parkinson's disease, like the late stages, Alzheimer's disease, all of that. So it's a huge burden on the healthcare system, but it's also a huge burden on the people that are caring for them. And whether that be healthcare professionals and families, it's just it's tough all around. So how can we support them in that area?
Right. And also, yeah, I think just seeing people in that state and that condition also kind of alerts us to like, oh, we should be healthier, or like, what can we do to try to avoid that?
Sure. Yeah, and I know, sometimes when even when I was in nursing, gerontology, long-term care, there wasn't really much interest in that because there's like, oh, what does the older population do? But when I was in my nursing school, I had instructors and professors that were like really into active aging, how to stay healthy. And so just got really drawn into like, how do we age well and stay active? And who are the people that are ending up in long-term care? What are some of the conditions that they have? What are some of the challenges that they're experiencing? All those things I kind of wanted to dig into because I'm like, I'm not going to create those habits for myself because I don't want to end up on that route, right? I want to find out, who are the healthy 100-year-old women and men that are still racing and doing yoga and doing all that stuff, right? That's kind of where I wanted to get into.
Yeah, it's inspiring to see those like 100-year-olds.
Oh, for sure. Yeah.
Active,
They have so many tips, right? There's so much to learn from them. So those were the things that I was fascinated with.
Great.
So I'm going to share a little bit on my screen so I can share some information, but feel free to ask me any questions as we go through. So I'll just hit the share screen here. So I'm going to explore a little bit about fitness nursing and how I incorporated bridging exercise with medicine and some of the lifestyle habits that direct our health. Just to go over what I will cover today, just in case you're kind of watching and want to figure out where I'm going to be. I'll talk a little bit about the current state of healthcare, where we're at this point, how I ended up going towards fitness nursing and what that is for me. And just what I really found out was it's our behavioral habits and our everyday decisions that really determine the direction of where our health goes. And there's 5 particular habits that we can all start and encourage our clients and people that we speak to, and how to break that and have better habits to design a healthy, fit lifestyle. So just as I shared before, the current state of our healthcare, if we take a look at our healthcare system, 75% of healthcare spending is really around 4 chronic conditions: cardiovascular disease, diabetes, cancer, and obesity. And if you think about some of these conditions, 75% of these conditions are a direct result of our behaviors and habits. Some alarming facts that I want to share. 60% of cancers, such as breast, prostate, endometrial, colon, are preventable. 80% of all cardiovascular and diabetes can be prevented, talking about type 2 diabetes here, such as hypertension, stroke, heart attack, and over 90% of obesity is preventable. So if you think about some of these conditions, and where our healthcare system is at, obviously our healthcare is not designed or focused on preventative care. It's really focused on managing disease. So I wanted to kind of look at health in a different way. One third of our population is obese. And for the first time in history, it's anticipated that our children are going to live shorter lifespans if we continue to live the way that we're currently living. And this is kind of scary, right? We want to really create a future where our children can be healthy and know what habits to create that are healthy. But if we're not showing those habits or displaying that either, it's just creating a generation of continual unhealthy behaviors. So my first taste of this truth was when my grandma, she had suffered a stroke. I think I was probably 13 or 14, but she lost all her function. Her left side of her brain, it was pretty severe. She was in a coma. There was a time where they had to decide whether or not they want to keep her alive or not, but my grandpa insisted on keeping her alive. So he decided to care for her, and he brought her home. So she was completely extended care. She needed full support and everything, but he provided all the supports for her. And that was kind of where I was feeling like Why couldn't they get my grandma better? Where was the rehab supports there? How was the home supports? At the time, my witnessing of this experience was there was no aftercare. It was kind of just left to the family to take care of her. She was fine in the hospital, and then she came home, and it was just kind of left on the family to manage. My second taste of this was when my dad suffered a cerebral hemorrhage. So he was 49 and I was 28, and he died probably within a 24-hour period. So that was pretty devastating for me. And when I think about my grandma and my dad's health, it was really related to obesity and metabolic syndrome. So that's kind of where my passion went around, what really is this all about and how is that impacting our health? And really, like, as a culture, we have different foods that we eat and that we like. And oftentimes when you're moving from a hot place to a cold place, you're eating the same things, but your body's not doing what it's normally meant to do with that food, and it's creating a lot of problems. So I learned that everything that I learned in nursing school wasn't kind of what I was experiencing in real life. So my learning in nursing school, and probably many nurses can experience or feel the same way, but our training was very symptom focused. We looked at individuals based on the problems that they have. I have a headache, I have this, and we try to treat the symptom instead of the entire person. It's system specialization, right? So we look at the cardiac health, we look at endocrine health, we look at, kidney health, like all those things. It's all very separated. So we refer, we go to a general practitioner and they refer to a specialist. So they're looking specifically at that area that they've been referred to. The directions is towards prescription drugs. I learned a lot about different medications, antibiotics, chemotherapy. That was our education, was with regards to the pathophysiology of medication and drugs. We learned about how genetics and risk factors in the environment impact our health. And a lot of it was really acute and primary care focused. So going out of nursing, that was kind of what I walked out into, even though I knew that there was more to nursing than that. But that was my education and training. So I had to unlearn a lot of things as I started looking into more information as to how I can kind of contribute as a nurse on my end. So the unlearning of it and sort of redefining health for myself was really getting to the root cause. Why were certain things happening? Why did my grandma have this stroke? What were some of the things that she was going through? And I'd asked a lot of questions, like she was going through lots of stress. I mean, she had 12 children in a span of a decade. So I can imagine that's quite stressful. And, she moved from Canada. I mean, she moved from the Philippines to Canada. She had to raise a family, kind of, she was a caretaker of her church, lots of things. So I started thinking about her history and my dad's, looking at people holistically. So as I said, I was very interested in community health. So, I know you work with the elders, they love storytelling. So you really want to find out, how they were, like why they got to where they, why did they get here, where they are today. I also learned about exercise and food was medicine rather than prescription drugs and antibiotics. I learned through personal experience and just working with my dad and kind of learning some of the things there. I realized that had they eaten better, moved more, it would have probably definitely changed the way that they experienced healthy living. The habit architecture, and I'll talk a little bit more about this, but it's more how are we designing our life, right? What kind of habits are we creating around our environment that's helping us or hindering us? And of course, personal responsibility, right? So again, in the healthcare system, we're trained or we're told that, physicians and the healthcare team are the experts, and it's not really up to us, it's up to them. So I learned that was also a myth. We really have to take personal responsibility for our health. And preventative care, looking into, why aren't we getting tested earlier? Why are certain things not being looked at? There's lots of things in terms of preventative care that we can support in. So it was really just for me defining a different way of looking at nursing and health. And this was the direction that I wanted to take. So in my career, as I was kind of transitioning from case management and trying to figure out what I liked, I ended up taking some education around personal training, more with regards to some kinesiology courses. I didn't do my BCAN, but I definitely finished personal training specialist. I learned about metabolic training. So just kind of getting into more of that and really understanding the science and anatomy and physiology, I realized how much benefit there was to fitness. And at the time I was saying, well, I can leave nursing and go into fitness because this is what I love. But I really still have a passion for nursing. That was it's always been my first love. And I said, I have to find a way to keep it together. And I don't know how I'm going to do that. So I think that I wanted to combine the two. And that's kind of what I did. So I said, I'll call it fitness nursing, and then I'll do it the way that I want to. So I did a presentation back in probably 2014 with regards to fitness nursing and what that means, and how to define that. Every, I guess in the States it's a little bit different, but here you really have to define what you do, identify the differences between what a personal trainer is versus a fitness nurse. And as you know, in nursing, we use the assessment process all the time. So that was a big piece of my practice in terms of when I work with clients. So this is how I define fitness nursing. I do a holistic and comprehensive physical, functional, lifestyle assessment, and work with the client and their physician and other healthcare providers in getting them appropriate exercise, helping them be accountable to any behavior modification strategies, and coordinating long-term support so that they can really be more self-aware of their health, their body, and how exercise helps them so that they can be more responsible in their own health outcomes. So that incorporates education, equipping them with certain tools and strategies, and just really empowering them so that they know that they have a say and personal responsibility in the direction of their health. And I think as nurses, we just really have a role to play in that. I think because the public really does trust the nurse over any other healthcare discipline, I think that we have an advantage there promoting a healthy living lifestyle. I think this is why it's so great that you're doing this with mindful nurses, because we can do anything in terms of how we can help our client, and there's just such a vast array of different directions that we can take to do that. So I think that's great.
Right. Yeah, no, I love that you combined your passion for fitness and nursing together. And I do think nursing is a bridge between like sometimes medical providers that are giving advice, recommendations, and actually and having nurses provide education and finding out what works for the patient, like realistically, given their past
For
habits
sure.
and their goals. So
Yeah, and even, when I talk about the learning and the unlearning of what I've done in nursing, I'm sure everybody experiences the same thing, right? Like when you think of patients, there's usually, one or the other. One individual would want the interventions. They want the medication. They want to give me the pill, give me anything that's going to take away the symptom, and that's fine. But you want to work with a physician that goes with your goals too. So if you're a naturalist, or I guess that's what you'd call it, you want a physician that's going to support, a healthcare provider that's going to support you in those areas as well. And if they don't feel that they can, do they have the resources to refer me to someone else? And I think as nurses, we can influence how a patient accesses the healthcare system. I mean, most of the times people are like, I'm going to do it myself, or they really delay having relationships with the healthcare providers. And then when it comes to the point of really needing acute care, there's no relationship, and they're walking in and they have poor health outcomes based on just not knowing where to go, who to talk to, and who's going to be really their support team. I think it's an important relationship that nurses can foster. I'm not against any kind of collaboration. I just think we do have a role in educating the client, the patient, and how they can navigate their health so that they can, improve their health.
Yeah, definitely. Sometimes patients just blindly accept recommendations, and then they're scared to talk to their provider for some reason. So, but it's good to just educate them to, speak up for what they want and what's realistic for them.
Yeah, and help them have a voice, right? I think that's the biggest thing. And I think that's why nurses play a big role, because we are most times their voice in the beginning. But we do want to empower and educate them so that they can, do that for themselves, right? I think that's why we're part of that, a big circle of nurses that try to support each other. So in terms of moving forward, the metabolic syndrome, there's two areas I believe that in terms of for fitness nursing that I target. And one of them is metabolic syndrome. And most of you probably know what this already is, but it's when 3 of the 5 are present. Belly fat. So if you have a certain waist circumference of 35 inches or more, and for males, if it's 40 inches or more, it's considered abdominal belly fat. Or high waist circumference, high cholesterol, high blood sugar, high high cholesterol and low HDL. So if any three of those are present, you're considered you having metabolic syndrome. So again, there's so many areas here that you can target for habit change and behavioral modification. But 1 in 3 individuals have metabolic syndrome already, and it's something that I think that we need to start tackling. The other area is the shift work lifestyle. So I know a lot of the nurses around here probably listening, they've got the lifestyle of a shift worker, and it really puts them at risk for different health issues. So they're not the typical 9 to 5 schedule. The way that they define it is working evenings, overnights, rotating shifts, having an irregular employer, all these different shift patterns. So it's not just the graveyard shift, it's all over the place kind of shifting. Is a shift work lifestyle. And it's not just nursing, it's physicians, it's other healthcare providers, it's service providers. Really the shift work lifestyle encompasses many, many areas now, I think. So those 2 areas create lots of issues in terms of how we can address their health. And as you know, when we're working with the sleep cycle, we're impacting all sorts of things with the health, with our systems, right? So there's cortisol, so there's our hormonal health, there is our physical health, there's our, emotional health. All these areas of our health are being impacted as you change the way that you sleep, change the way that you function in your day. And just by sleep alone, you can kind of influence all these areas here. And so if you're working against that, that doesn't help as well. So just some areas, I just wanted to quickly put this diagram up, because all of these issues can create disease if you're a shift worker, right? So again, I just feel that these 2 areas, if we can tackle these conditions and really work with individuals who are shift workers and those that have metabolic syndrome, and they probably might fall all in the same category, we can really minimize disease and help create change for them. Just some other areas I wanted to bring up with regards to poor sleep. So I bring it up because sleep is so huge. It's really, as regardless of whether you're male or female, there's always some kind of sleep issues that's happening now. We're surrounded by so many things in terms of, factors that impact the way that we sleep, how long we sleep. So I think and these are some of the health conditions that, can come out of that. And I've experienced that. I'm sure you've seen that in your practice too. But, sometimes we're just like, oh, I'm just having brain fog. But, when you look at all these other symptoms, you're like, oh my gosh, I have all of these too. Where am I going to even start for tackling my health? So it can feel very overwhelming, but it is good to start really being aware of what's happening to your lifestyle instead of ignoring it. And I think when we are so busy, we just kind of like, I can't deal with that now, I'll deal with that later attitude. And then we end up in poor health afterwards. Did you have something to say, Claudia?
Oh no, yeah, sleep is such a huge thing. Yeah, especially for the night shift workers, like nurses, healthcare professionals. So yeah, it just impacts so much of our lives, our health, like cognition and heart disease and things like that. So
yeah, and what I mean by fitness nursing, it's not just physical activity, it is everything. It's our spiritual, environmental, financial, like all of that is all encompassed within our fitness, because it all, they all kind of influence each other. So when I get into working with my clients, I'm like, okay, I just want to lose weight, get me to the gym, give me the exercise program when I get moving. And then I come do their session and they tell me they haven't slept, they only slept for 3 hours, or they barely had any breakfast, or they didn't do that. I'm like, I'm only with you probably 1 or 2 hours a week. What are you doing with the rest of the, how many hours left of the week without me? That's what really matters. It's not necessarily what you do here, it's what you're doing outside. So I really want people to understand, or just clients to understand, that it's all related to our habits, and we really have to start taking a look at how we're structuring them so that we can really fix what's going on. There's a book, and there's lots of different books that are on habits. There's, and you probably talked about a few, but one of my favorites ones is with James Clear. He wrote a book called Atomic Habits. And initially, in terms of habits, there was 3. There was a reward. I think I can't remember the 3 now. Yeah, reward, response. I can't remember the old one, but sorry, I kind of blanked out. But this one for James Clear, I like this model, is that first there's a cue. So what's making us do, create a healthy behavior when you're thinking of, what's one healthy behavior that you have, Claudia? Let's kind of go through yours and we can walk through it.
Well, I really try to keep up with my meditation practice in the morning.
Okay. And what is it that makes you do it? What's
I know that that is something that really grounds me and it gets me back to myself.
Yeah.
There can be so much happening in the world, all these demands that are asked of me, like checking emails. There's, people are asking for things or at work. So that's actually like a sacred time for me to just focus in and just be also.
And do you notice a difference when you don't do it?
Yeah. Well, there's, I don't feel as settled. I feel a little bit ungrounded. And also there's a little bit of guilt not doing that practice that I normally do. Yeah.
And how long did you find that it took you to start meditating without really making it kind of like something like I have to meditate today? Do you know how long?
Well, in the last few years, I dove more into yoga and meditation, and I had periods where I wasn't meditating, and then I was traveling for a while, and I was exploring different practices. And when I started working again full time, I really had to find practices, habits that worked for me that and I also had to kind of shorten the time too that I could do them, like realistically to fit it into my day. So I found that meditation was definitely something that I found important. I don't know, maybe the last year or so, or year and a half, I've been really trying to stick with that.
Awesome. And so all of those things that you said, like James Clear says, like your current habits are perfectly designed to deliver your current results. So you talked a little bit about the cue where you know that there's a reward at the end of doing this behavior. And the craving is that feeling of calm and grounding. So that's where the craving starts. The response is you actually doing it, right? Because you're craving for that. That's where the meditation is actually happening. And then afterwards, you're getting that reward again. So that's kind of where the habit loop is. So when you think about your good habits as well as the habits that you want to change, oftentimes our habits are changed by for one of two reasons. Number one, we're stressed, and number two, we're bored, right? So most times we're changing because it's becoming too much, or there's, like when you think about the New Year's Eve resolutions, it's because we're not working or we're more relaxed and we want to let's just change everything because life is, my body doesn't look good. So you're kind of bored and wanted to create a different change in habits. So good habits stockpile pleasure, and bad habits postpone pain. So you want to look at all the habits that you have and think about where you want to make change that's going to influence you. So I love that your meditation piece. Same for me. It was the same thing. So when you're looking at exercise, again, it's what is the craving for it? And really it's hard, right? You have to, like you said, it took probably about a couple, 6 months to get into it. But if you can understand that there's this process with this habit loop, you can kind of instill that in your brain more, because as what you do every day is how you are every day, right? So you want to make sure that those habits are instilled. And if meditation is a piece of you and you know what it feels like when it's not, like you said, you start experiencing that because you want that, you crave for that again. So it's great. So going back to chronic disease, if more than 75% of chronic disease is preventable, this means that we can change our habits and therefore change the direction of our health and life. So when I work with clients, or just kind of thinking moving forward, it's really having a skill set with your mindset. And again, a lot of this goes into how are you going to take personal responsibility for some of the work that you do. And this goes back to any kind of habits, and exercise is always included, but you want to have food, beer, information, right? So rather than thinking about the symptoms that you have, you want to be able to provide information, whether it's to your physician or just to keep track for yourself, is what am I eating and what is this food giving me? You want to look at food as information. You want to take a look at things holistically. So rather than identifying your problems as systems, pain here or this there, you want to present your information as a more holistic approach. This is what I did in the last few days. These are some of the things that I probably had done to trigger this. You want to be able to provide as much information so that you can take a look at your health. Instead of accepting prescriptions and drugs, drugs for care, look at lifestyle changes, your eating habits, stress, exercise, and supplementation options. There are always other areas that you can take a look at to improve your health and your fitness. And it's not just ensuring, I'll just go to the doctor to deal with this foot pain, or I'll just go to the physio and just get this piece fixed. I want to take a look at your lifestyle. What's creating the pain? Let's go back to the root cause. Decide that personal responsibility and taking action is what's going to help better your habits. And I think with that mindset shift too, that can be very hard, because oftentimes we're put in positions where, like, I didn't do this to myself, or, it's because, the environment that I'm living, or it's the people that I'm with. And really, like you said, it's you end up, and nurses are great at this. I think this is why nurses are the best people to give information with regards to this, but we're great at being chameleons, right? We can adapt to change. Sometimes we thrive on it. We really know how to manage that sometimes. So by helping clients and ourselves show that, we can demonstrate that we can improve our habits and learn more about our body and share what we know with the clients that we have. And don't believe that you're destined because, my family has had diabetes, or my whole family has had a history of cancer. Don't be focused on believing that's the case. You want to explore practices that will keep you away for good. And, I have my family side is full of heart conditions, heart disease, cardiovascular disease conditions. And I'm more aware of that, definitely. And I'm taking the actions to move in a different direction. But I think until we understand that piece of it and know that, it'd be a hard shift to make change if I still believe that I can't change. So those are some of the things that I explore with my clients, and taking a look at the skill set that they have. Any questions so far?
No, that sounds really on point. And there's also, like, epigenetics, like even if you're given like a certain genetic makeup, you have a lot of things that you can do to change that: diet, exercise, and controlling stress levels and things like that. So
Yeah,
they're
for
not
sure.
for certain disease for the most part.
Yeah, 100%. And I think so. I'm kind of exploring here, and I want to share some of the unhealthy habits that put us at risk for many things. And like I said, we can change our whole lifestyle, but it's hard. We need to make changes in small areas too. So usually there's 5 areas, and it's the 5 S's to think about um, in terms of changing the way that works, improving our health. There's not enough sunshine, consuming too much sugar, a poor sleep routine. I'll get into these a little bit more. No energy to strength train, and mismanaged stress. So these are often the 5 areas that I'm finding with both kinds of clients, whether they have metabolic syndrome or they have shift work issues and caregiver burnout. These are probably the 5 that always consistently come up. And usually these are the areas that I work with them to get these in on a better path. So when you think about not enough sunshine, and I know we're all familiar with this, but there's melatonin and vitamin D that play a role in how we absorb the health benefits of sunshine. By incorporating and having more knowledge about vitamin D and how our body absorbs it, depending on where we live, we can find ways to boost our immune system. We can help with our circadian rhythm and normalize that. There's been research that's found sunshine is linked to better sleep and decreasing belly fat. And there is lots of research with regards to supplementation used for vitamin D. And I'm sure many people, and even with my clients, as soon as they stop taking or forget their vitamin D, they notice a difference already in their mood and their energy. So, and we're in Canada, and especially where I live, like all of us are pretty much deficient in vitamin D. So it's definitely something that we're big on promoting. And I know where you are, being outside has to be key, and going outside at the right time so that you can get the D right at the right time. So I teach my clients how to take a look at that and start paying attention to their exposure to outside, because when they're in shift work, they're in the dark, they're in buildings with no windows, or if they're inside for too long, it's just they're not getting any kind of exposure to any kind of fresh air. So that's huge, that even if they just start supplementing and using infrared lights, or those sad lights that are available, there's different ways that they can incorporate improved health for their vitamin D levels. Consuming too much sugar. So this is big, and I know this is talked about a lot, but you do create glucose instability. So there's different areas that you can take a look at in terms of habit change, looking at the meal times that you have, what's accessible to you. So especially with habits, there's proximity, what's around with us, right? When we're shift workers, it's kind of like the donuts and the pizza are in the staff room and everybody's offering some kind of treat or something that's available. So we know that a lot of our mindless eating is a result of our environment. So we want to make sure that we try to create that so that it's not going to be too damaging. And just having a better understanding of insulin resistance, what it means to have type 2 diabetes. I mean, a lot of the times, especially when people are just learning that they have diabetes, like my mom, when she first found out that she was at risk, she cut down all sugar like within the next 2 days, and she almost fainted. I said, you can't do that. Like you have to ease into it slowly, find a way to, that's going to be comfortable for you. But I think it's just understanding your body and what you're going to be going through as you, find ways to improve the way that you consume sugar, but you don't want to go too crazy and create more instability, right? So that's where one area we can help in. So again, I'm going back to the sleep. Sleep does impair our metabolism, especially when we're on the cell phones at different times of the night, using artificial light and even the fluorescent lights that we have in the hospitals or clinics. It impacts the way that we digest our food. It weakens our immune system. There's conditions called shift work disorder and workplace injuries. So that can create a whole slew of issues as well that you want to change. So again, look at these areas in terms of for example, for the artificial blue light, are there areas there that you can change that by going to sleep, turning off the phone, using flux on your computer, blue light blocking glasses? There's different areas that you can find ways, and you can get really into a great, you can create a good self-experiment by trying these different things and finding out if these are impacting your health. And, you start feeling healthier and more excited about taking care of your health as you try different things. This is one that I'm always pushing, but not making time to strength train. So I know many individuals that, I like my yoga, I want to go to CrossFit, I want to, I'm a runner. As we get older, if you think about some of the conditions that are prominent, right? There's diabetes, there's cardiovascular disease. The area that the body gets fuel first is muscle. And so when you're not having enough muscle, and women already have many challenges for building muscle, if we're not taking the time to focus on building muscle, strength training, building resilience in the body, it's really going to create a lot of problems with regards to the way that we manage our energy, our body shape, and our composition changes. It puts us at more, we're more prone to injury and poor recovery time. If we're not being active at all and not doing any kind of strength training, it can lead to anxiety, depression, some GI issues. There's really many benefits to the neurotransmitters, the chemicals, and all the hormones that are released when we strength train versus doing stuff like, running and yoga. There's different hormones that are released each time, but what is our body looking for when we want to build muscle? And we really have to start paying attention to building muscle versus losing fats. I think we need to change that narrative. And then the last one, and I know this is always the hardest, but mismanaged stress, right? So blood pressure and cortisol always plays a role here. We can check blood pressure. We can kind of monitor cortisol just by finding out certain questions, like how are they, when are they waking up and when are they sleeping? Especially when we're finding that people are relying still on, smoking and alcohol, fatty food, relying on over-the-counter prescription. Again, when you're looking at habit changes, you want to find out what are you doing to manage your stress and cope with life. And a lot of the time, shift workers are, I just want to zone out. I'm going to just Netflix and just zone out and go into a different world. And let's forget about life and just eat. And I find that so common, but it's not necessarily willpower. It's just because we're not really paying attention to some of the things that we're doing. Maybe have a glass of water first. Those kinds of things. Or can you make changes so that we're decreasing our stress and not calling in sick all the time because we're not well or not feeling good? So our belief in ourselves, just to kind of wrap it up, I know we don't have much time left. I want to leave it open for some questions, but our belief in ourselves instructs how we value our time, and what we model then is what duplicates. So again, think of how we structure our day. How do we design our life? And how do we create the habits that support the direction that our future self wants to be in. So another model that I kind of try to encourage is drive, right? Like you're the driver of your life. So just detox from distractions. And for you, that can be the phone. For me, it could be, kids, not, no, not me not having boundaries with kids. You really want to take a look at what are the distractions and find ways to detox from that so that you can find your way to better energy management. Rest, restore, and reset. So again, we're always in that go, go, go lifestyle. So really focusing on scheduling rest time, scheduling time to really just not do anything. We don't do that in our schedule. We always look at the white space and kind of be like, okay, I need to fit something in this piece. And I really try to encourage a rest-based living lifestyle so that you can decrease stress. It plays a role with, I find many nurses that are my clients, this is probably the hardest because they're like, I don't know what to do. Like, I don't know what to do. It's quiet. I'll clean up or I'll do something else. I feel like I'm wasting time, right? It's a challenge. It can be a challenge. And it's interesting once they start listening to their self-talk, how much they scold themselves for resting. So I really try to beat that out of them. Intention over impulse. So again, this goes back with habits. What are we impulsively doing that we know that we can change, and to create an intention over that. So if me using the phone at 10:30 at nighttime and my intention is to, trying to sleep, have better sleep, and know that the phone's bothering me as I pick up the phone and look at the time and it's 10:36. I have to have an intention versus, okay, fine, forget it. I'm giving up to willpower. So what's my intention for picking up the phone? So any action that you take, you really want to have some intention over that. Why are you doing what you're doing? Valuing self-care. So again, this is hard for nurses who are caregivers and any, women, I think it's, or any kind of caregiver personality, but you have to value self-care and understand what that is for you. Because you want to incorporate those practices into your day. And that not only just helps you mentally, it helps you with productivity, it helps you with your relationships, it helps you with wealth. So it really encompasses everything in terms of the wellness area. And then energy management, right? So it's not, it's not time management, it's how are you managing your energy. If you know that, working out, your meditation is best as a transition. Like for myself, I meditate in between work and going home. I use it as a transition time so I can really center myself. Before, I used to love doing it in the morning so I can start my day. And it just came that I'm like, okay, I need to find another time. I know that I need to do it, but I know that I need to use it at a time where it's helping me regain some energy and some groundedness again. So whether that's meditation, fitness, setting some time for yourself to just read or be by yourself or journal, you really want to manage. Sort of we live is a lesson that we teach. Again, I love what Mindful Nurses is doing because these are nurses who are all mindful in terms of how we're providing help to our clients. And I think it is, what you're presenting here, what you're offering to other people we want to live the lesson that we teach. So I think that's how I want to end it off and just say, thanks for having me here. If there's any questions, let me know.
Thank you, Marianne. Thank you so much for sharing. You had some great points there, and I love your acronym DRIVE. Really good, the detox and rest. I think I remember when I was working in the hospital, and I needed to transition from working and home, and I just couldn't watch. Like a popular show back then was House MD, and I just could not watch it.
Oh yeah, I loved it.
But I just couldn't do it right after being in the hospital for 12 hours. So that was kind of had to hospital detox after that. So I really noted that would help. And also I just, needed time to not talk to anyone for a little while and just be quiet or do what I needed to do. Because I was busy
100%.
That whole day. So that was really valuable to also just sense what you need and what's right. So thank you for that. And then
and I think, like you said, it's really self-aware.
Say that again. Oh, sorry, I didn't.
I said it's really self-aware. Self-awareness is key.
Oh, yeah, noticing your habits and how you're feeling. And then, yeah, what you said about scheduling rest and not always trying to be like productive and doing things all the time is, I think that's a really important thing to emphasize. Because I mean, there's endless things that can be done, like cleaning the house, laundry, doing a lot of things, but it's so important to schedule rest, because also by doing that and having that time to rest and relax, then you end up being more productive and energized and creative in other times. So thank you for mentioning that. Yeah. But yeah, these are great tips for your clients and nurses. Yeah, it's very valuable. But thank you so much, Marianne.
Thanks for having me, Claudia. I appreciate it. If there's any questions or if you need to reach me, you can reach me on Instagram. It's marianne.yourfitnessnurse. Then you can contact me there and we can get connected, and you can ask me any more questions there.
Great. Thank you. And happy Wellness Wednesday to everyone. We have sessions every week, so tune in. We also have our website, www.mindfulnurses.com, where you can check out the full schedule. But see you next time. And thank you so much, Marianne. Have a good evening.
Thank you.